Hello everyone, this is an overview of EMS systems for EMT 200. We're going to talk about the different EMS provider levels, the system types, how it's regulated, and deal with some alphabet soup and explain what some different organizations play and the regulation and oversight. And we're going to go into a little bit about how dispatch works, public health, and how quality improvement and research, what that can play in our everyday practice, and some exciting roles that I think are coming for EMTs and paramedics. The different EMS types of systems, it's said if you've seen one EMS system, you've seen one EMS system. There's dozens of models of delivery across the country. Most of these sprouted from local tradition. Some are delivered by the fire department. Sometimes the fire department does first response, where they'll show up, do some first stabilization and initial care, and another agency transports the patient to the hospital. Some fire departments do first response and EMS transport. There's private companies that have contracts with communities, sort of like similar to how healthcare agencies work, and bill patients and get most of the revenue from that. Some other services are run by hospitals, which also have contracts with communities based on things like response times and the provider levels that show up on scenes. There's also volunteers, and then there's municipal services, which are the third service, which are EMS agencies funded by the government outside of a fire department. So Delaware's 3 county paramedic services would be considered third service. So, for example, Delaware's EMS system, the paramedics are employed by one of the counties. Most of the EMTs work for a fire department, and we'll get into how that evolved in a minute. If you go into New Jersey, all the paramedics work for hospitals. That's a state law. And if you go into the D.C. area, those firefighters are also, or those paramedics are also trained as firefighters, and those are some large municipal fire-based systems. So at the federal level, EMS is overseen by the National Highway Transportation and Safety Administration. And the reason for that is, part of the reason systems were born was in 1966, there was the white paper, Accidental Death and Disability, the Neglected Disease of Modern Society, because with the growth of the highway system, there were lots of traffic fatalities. So as a result of that, NHTSA was established, and one of the things NHTSA worked for was setting standards for ambulances. Before that, there really were none that set a minimum education requirement at the EMT. Now, NHTSA, a lot of people, I included, think EMS has outgrown NHTSA and should be under a different agency, but NHTSA sets a scope of practice for 4 provider levels: emergency medical responder, emergency medical technician, advanced EMT, and paramedic. And then they also set education standards that agencies, organizations like us that do education must meet in order for graduates to be certified. Now, these are guidelines. Most of the regulation is from the states, and states can choose to follow them or not. The standards are the basement. Those are the minimum levels, and states can add more skills to each provider level, and many do. So in Delaware, we have the EMTs staff most of the ambulances, and most of the ambulances are staffed by fire companies. They have some volunteers, but most are paid now, and they are overseen by the State Fire Prevention Commission. So if there's an issue with an EMT, with care provided, or something that an EMT does off-duty, that's the Fire Prevention Commission that regulates it. They also set the standards for ambulances and certify that ambulances are safe to operate and meet their standards. The paramedics are overseen by the Office of Emergency Medical Services. And the reason that happened is in 1990, there was a state law passed establishing the county paramedic systems, and there was a new state agency that was in charge of overseeing the paramedics. So everybody goes on calls every day with the paramedics and the EMTs, but they are overseen by different agencies. The paramedics respond in mostly non-transport vehicles. There's Suburbans or modified pickup trucks. And in Delaware, paramedics only respond to calls that are believed to be life-threatening after a call gets triaged by a dispatcher. So a BLS ambulance responds to everything, and calls that they believe are life-threatening will receive a paramedic unit with them. It's also a state law that 2 paramedics must be dispatched to every call. And when the paramedics arrive on scene, if the patient requires continued treatment on the way to the hospital, all their equipment's portable, they go on the ambulance and ride with the patient there. If there's a television show from the 1970s, there's lots of episodes on YouTube. I recommend watching one called Emergency, which is the birth of paramedic systems in Los Angeles as an extension of the fire department. And the model they used then looks pretty similar to the model we still use today. So what are the provider levels between an EMT and a paramedic? Well, emergency medical responders, that's the lowest provider level. They're designed for people not staffing ambulances. They're staffed for police officers, firefighters who aren't going to work on an ambulance. They're there for initial stabilization and to hand off treatment for another provider. EMTs are the lowest certification level that can staff an ambulance. They do basic life support. The line used to be at a medication or airway device, but some EMTs can place some advanced, or what we consider advanced airway devices in addition to CPR, and they can give some medications and give asthma medicine or an EpiPen. AEMTs can start IVs and do some other more invasive procedures and administer a few medications. And paramedics are the highest level of certification, cover more in-depth. Their education is more in-depth discussion about diseases and more invasive procedures or airway and medication administration. So now, for education, these are regulated by the states. So EMS is predominantly regulated by the states, and we have this scope of practice model that we work under, but it's the states that actually regulate what we need to teach in an EMT class and what we need to teach in a paramedic class. And upon completion of the program, you can be certified as you take a national certification exam. We don't administer it. As the National Register of EMTs, they have their own exam, and we certify that you're prepared to take it, that we've covered everything, that you've passed everything in the class. But that is what permits you to become certified as an EMT. Not all states follow it, but Delaware does. And the National Registry of EMTs is the certifying body. They don't oversee our education. They administer the test for initial certification and ensure that you meet continuing education requirements after you are certified. Paramedic and AEMT level programs must also be accredited. So in order to take the National Registry EMT exam, you must be accredited. And for accreditation, we need to demonstrate that we've, again, taught everything that we meets the standards that the state sets, and that you get good clinical experience. We share our passing rates, our graduate, how many of our graduates are employed. We survey our employers who graduate, and that's all part of our accreditation report. Now, just because you're certified doesn't mean that you can practice as an EMT or a paramedic independently. You must be licensed by a state. The certification says that you have successfully completed the program. After you get certified, you can become licensed as a state. Different states have different requirements for that. In Delaware, it's a protocol test, and then you need to maintain continuing education in order to keep your state EMT license. That is what permits you to practice. The certificate says you graduated. The license says you're allowed to practice. And once you are licensed at the service level, you must be credentialed. So you can have your certification, you can have your license, but you need to also pass your agency's orientation program. They'll have a field training program that credentials you to practice, and that is what the medical director is involved in. So that's the final level for you to practice. Now, EMTs, paramedics are not independent practitioners. You must operate while on duty as part of a licensed EMS agency. And you also cannot operate outside your scope of practice. So I work as an EMT. I'm a licensed paramedic, but I work for a fire department as an EMT. I cannot practice as a paramedic while I am working for the fire department because the fire department is a licensed BLS agency. It is not a paramedic agency. So before you get released to practice, then you need to be credentialed, and that's what the agency's medical director is involved with. The medical director is involved with protocols and standing orders, and they're also available for online medical direction. The protocols in Delaware are statewide, so there's a committee that puts together, and these are treatment guidelines for frequently encountered conditions, and then there's a general patient care protocol that covers most other things. They are guidelines, but you need a permission to deviate from them. That acknowledge there are special circumstances that you may need to deviate them from. But in order to do that, you need to consult medical control. So you need a doctor's permission to deviate from the guidelines that are set forward. So those are the standing orders. The standing orders also include some procedures that you need permission from a doctor to perform. In some circumstances, if a patient refuses to go to the hospital, you need to contact medical control and discuss with them. Mostly at the ALS level, there are some medications and procedures that you need permission from a doctor to perform because they're invasive and they're potentially dangerous. So who determines when a paramedic and what patients receive an ambulance alone? And that's when you call 911. The first person that answers may be at a public safety access point, and they call and they may say police, fire, and ambulance. And they say, well, I need an ambulance. And sometimes that person can continue with the phone call and do a triage form that's based on it's an international system called the Medical Priority Dispatch System. And they'll ask a series of scripted calls to determine the severity and if there's any pre-arrival instructions that can be given. And they also determine whether lights and sirens are indicated or if the ambulance can go transport to the scene without lights and sirens. Driving lights and sirens is very dangerous for us and for the community, so we want to minimize that as much as they can, and that's one of the purposes of priority medical dispatch. EMS also plays an increasing role in public health and injury prevention. There is one, they address pool drownings. Paramedics hand out bike helmets. They'll use data for crash intersections and to try to make the roadways safer. And we're getting increasingly involved in disease prevention and trying to prevent 911 calls from being necessary. This is a relatively new, within the last 10 years, program called Mobile Integrated Health, where paramedics with additional training visit people outside of 911 calls. Maybe it's a frequent caller for someone is having difficulty managing their diabetes or asthma. And they'll assess them to try to avoid a 911 call being necessary. They also follow patients after they get discharged from the hospital. And finally, there's what's continuous quality improvement. And this is what can we do better. So this is when you enter, mostly through chart review, how often are you performing a certain procedure? When you arrive on scene, how long is it taking you to ventilate a patient with a bag valve mask? How long does it take do you spend on scene? All sorts of things that ways that we can improve our care, improve the system stress. Research what calls need paramedics. There was a study in Delaware from about 20 years ago that looked at abdominal pain patients, and they realized that most of them did not need a paramedic response, and they actually changed the protocols based on that. So some paramedics get involved with research, at all levels, but everyone is involved just when they complete their patient charts and providing good documentation and reporting. So that's an overview of EMS systems. There's a lot more to come to this. This is just a brief sampling of everything that's going to be coming. So take care and thanks.